All right, guys. Happy St. Patrick's Day.
Is it St. Patrick's Day?
Well, we're releasing this the day before St.
The day
Patrick's
before.
Day.
So,
Happy St. Patrick's Week,
yeah, there
especially
you go.
for those that drink all week to celebrate.
Mm-hmm.
Yeah. I know we said leprosy would be next, but
We had a little change of heart or schedule.
yes, we couldn't pass up the opportunity for a good old St. Patty's Day episode.
Yeah.
And I think moving forward, we are going to try to do more and more holiday-based episodes because there's a lot to know. And this gives us a reason for something fun.
Yeah, it's fun, it's different, and it's in theme.
Yeah. So we have a week of exploring ergot, a fungal disease. Well, fungus that then can turn into poisoning and all these different things.
Yeah, it's a wild time.
Yeah. And then the real story of St. Patrick's. So not quite as medicine related for the real story of St. Patrick's, but I thought it was pretty interesting. So
yeah, it's interesting.
Then we're going to jump back into leprosy next week.
Yeah, don't worry. We're not giving up on leprosy.
No. So episode 13, we have the bread that caused hallucinations, gangrene, and witch trials. Ergot.
Yeah, I'm going to get to the witch trials. I'm not sure I'm buying it.
No, a lot of people are buying it.
A lot of people are skeptical.
Yeah.
I think it's an excuse for people's behavior.
Okay.
But we'll get to it.
Okay.
And then you can decide.
Yeah. Well, welcome, Cadaver Crew.
Get your dark little minds right and settle in.
Class is in session and the cadaver is already on the table.
I'm B.
And I'm Sam.
And this is the Cadaver's Lessons.
Vitals check.
Yeah. So good.
It's been a pretty good week.
Yeah, it's been a pretty good week. It's been a little busy.
Busy for sure, but
yeah, been good.
Yeah.
Can't really say anything jumps out at me.
No.
I made this frozen wonton meal today. That was pretty banging.
It was pretty banging. Got a big bad story. We're going to combine our ER moment with our bad for the week. Sunday night, I had acute onset, horrific pelvic pain. I don't know how to describe it whatsoever, and within 5 minutes knew we were going to the emergency room because I've never been in that much pain in my life. And unfortunately, they were very, very busy. It took a while for me to be seen. It took even longer for my ultrasound, but very luckily I untorsed. So everyone in the medical team that was involved believes that I had ovarian torsion, which your ovaries sit on these ligaments, and these ligaments can sometimes twist. And as you can imagine, that's incredibly painful. And when they twist, they cut off blood supply, and it's a surgical emergency to get people to the OR. And it's like 6 hours of viability for the ovaries when they get their blood supply cut off for a relatively high survival rate. Everyone believes I had ovarian torsion and that I untorsed prior to my ultrasound, which I believe because I was in horrific pain and then felt as the pain started to get better without any pain medication or, anything else really in place. Luckily got to go home without going to the OR that night, but am under very strict, if it happens again, they will be taking me straight to the OR, kind of no matter what the ultrasound says, if I detorsed. So that was a scary night. That was a long night.
Yeah, it was a late one.
Yeah.
It was late.
Yes.
Yeah. And then we had to go to work. We both went to work.
Both went to work the next morning.
Yeah.
So yeah, that's our ER moment. If you have never heard of ovarian torsion or testicular torsion, it happens in the testes too. You should look it up. It's something I think everyone should be aware of because it's brutal and there's a timeline. I find people in the emergency room, particularly men, have this testicular pain and they don't want to come to the ER because they're embarrassed about their testicular pain. And I'm like, well, when did this start? And they say some ungodly amount of time ago. And luckily, I've never had a true testicular torsion that's been found. But the amount of men that come in and would have lost the viability of the testes by that point is quite high. Podcast wins.
Yeah, we hit 800 streams. That's crazy.
That's crazy. We're so close to 1,000, which is really exciting. We have new countries popping up all the time. Some notable is Brazil this week, hit Japan, United Kingdom. Yeah.
So thank you.
Yeah.
And keep spreading the word. We want more.
Mas.
Yeah, we're greedy like that, I guess.
Yeah. And then we actually had 2 people send in requests for episodes this week. So the first one was on radiation, which I can't believe I didn't think about already. And we'll probably bump it up in the episode list because I'm so excited to talk about it. And then the second one was, and I might pronounce this wrong, puerperal fever. And essentially the puerperal time period is around like labor and delivery is my understanding. I've not looked into this at all, but there's this horrific bacteria infection that can happen, and it used to happen a lot more before hand washing.
That important thing?
As you can imagine, and it was really bad for these women. So we have to decide. We have this huge OBGYN list. Do we just knock it out like 6 weeks in a row? Do we spread the love a little bit? I don't know.
Yeah.
Yeah.
To be decided.
TBD.
If you got an opinion, let us know. Would you like to hear 6 weeks of OBGYN or spread it out, sprinkle it in here and there?
Yeah. Okay.
Anatomy crash course.
Let's get things started. So ergot is a fungal disease of rye and other cereals and some other things as well. Members of the fungal genus Claviceps parasitize important crops such as rye, wheat, barley, rice, corn, millet, and oat. Specifically, the Claviceps purpurea infects plant species with this ergot disease. Eating this contaminated food causes ergotism, and we're going to see that it largely affects rye because the growth cycle is at the same time as Claviceps purpurea spread, so it's more susceptible to infection. Ergotism is defined as poisoning caused by toxins, causing either severe hallucinations and seizures or extreme vasoconstriction that literally cuts off blood flow to the limbs. It's awful. This was really bad.
Bad.
I
don't know. Maybe we can talk about it at the end, but which one you would rather have? I'm going hallucinations.
I'm going hallucinations for sure.
100%.
For sure. There's 2 major types. There's the convulsive ergotism, which is the severe neurologic disease. So signs and symptoms, violent muscle cramps, convulsions, hallucinations, and intense mental status changes, mania, delirium, paranoia. And then there's the gangrenous ergotism. So there's extreme vasoconstriction. So squeezing of the blood supply. This, as you can imagine, causes diminished blood flow and the development of dry gangrene, which causes loss of fingers, toes, and limbs. What is gangrene? We should probably know before we get started with this episode. It is localized death and decomposition of body tissue. No bueno.
Yeah, not great.
Not great. And then in medicine today, it is still used. We'll talk about it a little bit, but migraines, postpartum hemorrhage, manage specific neurological conditions such as Parkinson's. It is not first line for any of those things, but I think it's really interesting that we still roll the dice a little bit with this medicine.
Yeah, it's very particular on the amount. Like, yeah. You gotta be sure.
Gotta be sure.
You're given, because you go over that little bit and you're going to experience some serious symptoms.
Serious. And then this is actually where LSD is derived from.
Yeah.
So I was thinking about putting a lot of information about LSD in this episode, and then I realized LSD needs its whole own episode. Yeah. Did you know that it was used by the Secret Service for an interrogation techniques?
Yes.
You did. I feel like that's a fun fact you should share with me.
Sorry, I didn't know you didn't know.
No, I didn't know that. We're going to get into it on a full episode.
Don't worry, we'll get there. All right, so let's get into the history. There are some very early references to ergot. Ancient Chinese medical texts around 1100 BCE described ergot being used to stimulate uterine contractions during childbirth.
And so that's speaking about that postpartum hemorrhage.
Yep. And then in 600 BCE, there is also an Assyrian tablet that referenced it as a noxious pustule in the ear of grain. So if you look at a ear of grain, you can see the black kind of
budding
almost. That's why they call it ergot, because it's a French word for the spike that comes out of it, kind of like the rooster's foot, the same kind of thing. And so that's how you can notice it. And so we're getting into it, but they knew this was a thing.
Yeah.
They knew it was a thing, but they couldn't quite put together that the black thing on your wheat
was poisonous.
Or your cereal rye or whatever it was poisonous and was causing this. And then in 350 BCE, in one of the sacred books of Perseus, there were descriptions of noxious dresses that caused pregnant women to drop the womb and die in childbed.
Yes. Are you going to go into the horrific uses in labor?
A little bit.
Yeah. When I was looking it up, lots and lots. Some were used purposely for abortions.
Yeah.
Right. But also some were used for preventative things, ? And it did not end so well for the pregnancy.
Yeah.
Yeah.
So even though ergotism is thought to have occurred in ancient times, it really peaked in Europe in the Middle Ages, of course, because
everything happened
dark
in the
things
Middle Ages.
happened in the Middle Ages. When the disease affected many thousands of people.
Oh boy.
And although people knew the effects, they did not quite put together that a fungus contaminating grain was responsible for the reactions happening in people. So during the Middle Ages, rye was a staple grain across northern and central Europe. And since the fungus thrived in cool, damp climates, this was the perfect place and time.
Of course.
Yeah.
Right place, right time.
You know, all those gray skies. Because I think England and some of the other European countries are very much like the Pacific Northwest. So, which is where I grew up.
Yeah.
So I understand the gray, damp, dark places that exist. So eating this infected rye caused multiple devastating epidemics of ergotism throughout the time. The fungus would replace the grain kernel, and dark black purple structures called sclerotia would contain potent toxic compounds known as ergot alkaloids. Care was usually during this time given by a monastic order that followed the patron saint of Saint Anthony, which is how we get our other name for ergot, which is Saint Anthony's fire.
Yeah, which is not for good reason. It's because it's so effing painful that they named it after.
Yeah, so who was this guy? Saint Anthony. He lived between 251 and 356 Common Era.
He lived a long time for these ages. He must have been minding his own business.
He was, actually. Let me tell you. So he was the founder of Christian monasticism and patron saint of gravediggers.
So he wasn't minded his own business.
He was born into a noble family, but at the age of 25 gave away all of his possessions to the poor following the advice of St. Matthew. He then retreated to Egypt along the Nile River, where he lived in solitude for almost 20 years.
Wow. It's a long time alone with your thoughts.
Well, I mean, if you live 100 years, it's really not that long.
I don't know, 20 minutes feels like a long time alone with my thoughts. So
yeah. It was reported while living a life as a monk, he struggled against the devil while resisting temptation. So this is the huge connection to St. Anthony's fire. He was kind of pulled in by demons and the devil and was trying to consistently resist that temptation. So that's the connection there. Now, common belief was that the sickness was spiritual, when we're talking about ergot here, and that divine intervention could treat it, pushing for the opening of special hospitals set up and manned by the monks, dubbed the Hospital Brothers of St. Anthony, or the Order of Hospitaliers.
Wow. They always think it's divine intervention, you know?
Well, in the Middle Ages, they do.
Yeah. Well, even now sometimes when there's not an explanation for stuff.
Yeah, it's kind of crazy when we talk about the history throughout all these episodes, and we talk about ancient civilizations such as, Egypt, the Middle East, which is Egypt, and then into like Roman era. And it's all very scientific. Everything is scientific, the four humors, and it's all written down, medical text. And then you get into the Middle Ages and they threw all that stuff away and they said divine intervention, and religion took over medicine. So then we had to get ourselves back away from that a little bit and rein it back. And it's like separation of church and hospital, I guess. I don't know.
Church and hospital. Okay.
Not that there aren't good spiritual things that connect to health.
Yeah, I wonder if like the St. Anthony's near us is named after the St. Anthony.
Yeah,
probably. You assume so, right?
Yeah.
Yeah, okay.
But then you have to remember it's a patron saint of gravediggers. So then I'm like, do you want your hospital named after?
Small details. Small details.
So these monks that really treated all of the people that were suffering from ergot at the time wore a black habit with a T-shaped St. Anthony's cross, also called a two cross in blue. So it was in blue, and so it's basically a capital T is what it looks like, and it would go across their chest. And so that's how you knew that monk was responsible for caring for people with ergot.
Interesting.
Yeah, so they had a whole order of people responsible for it. So like I was mentioning, the disease itself became known at the time as Ingus saucer, or holy fire, also known as St. Anthony's fire because of the burning sensation in the limbs.
They just ignored the hallucinations in this. They said the limbs. Hallucinations? Fine.
Hallucinations we're down for.
We're down. Seizures, delirium, any of that, whatever. But the limbs, St. Anthony's fire.
Yeah. These treatments by the monks, which included basically removing contaminated rye from the diet, I was like, that's a good place to start.
Great place to start.
And they then fed the ill uncontaminated bread and provided supportive care, like normal supportive care. And so it did work.
Yeah.
Because they were removing the poison.
Yeah.
But I'm not sure they really knew that. But the dietary changes alone likely saved lives.
Yeah. And even today, that's still the first line treatment, among other things. But the very first thing is stop the offending agent, you know?
Yeah. Now, ergot was especially damning for populations because it could have affected fertility as a result of ergot toxification, causing the population to have a harder time to recover between outbreaks.
That's such a good thought.
Yeah, so we see multiple outbreaks happening over and over and over again, with the growing season and with rye coming in, and then they're having a harder time keeping up fertility-wise, plus everybody is
not eating as much.
And they have toxins probably built up.
Yeah.
It may be harder. They're maybe not as fertile or,
yeah.
So.
I mean, I imagine if it's causing uterine contractions and vasoconstriction, not enough blood flow to the uterus, like all of those things, does not fare well with fertility.
Not great.
I had this professor in PA school that called our guesses swags. Do you remember me talking about this? And they were called scientific wild ass guesses, meaning like you put some thought behind it, but you're just kind of, you're guessing it out.
Yeah.
And my swag in this is that probably no bueno for fertility.
Yeah, probably not good.
Yeah.
Your swag.
My scientific wild ass guess. Don't you love that?
Yeah, I love it.
Yeah.
We should use that more often.
I agree.
So we see this ergot spread, and here are a few really, really bad epidemics that hit.
Oh boy.
So in 857 Common Era, the Rhine Valley epidemic occurred, and tens of thousands of people died.
That's a lot.
Yeah.
Especially in these times.
Right. The physical burning sensation sufferers felt in their limbs linked the disease to hellfire. We're getting back to the divine.
Yes.
Here. The sense that the illness had been sent down to these people as divine punishment. And it always just pisses me off so much when people do this. It's like tens of thousands of people are suffering and they're like, well, you deserved it.
Yes.
We don't have an answer, so you deserved it.
You deserved it. I also think it's so interesting. Like, tell me what this many people were doing wrong that they deserved it. Right?
Well, I don't think I've gotten into it yet, but conveniently, if you will, the biggest population affected by ergot was poor people.
Well, of course, because rye is relatively cheap, right? Yeah.
Yeah.
Man, that's the way these things work, you know?
Yeah. Rich people had wheat. Poor people had rye.
Yeah. Okay.
So, of course, they were sinning and needed to be punished by the divine.
Yeah.
It's because they're poor. Then, about 100 years later, the first well-documented epidemic of ergotism occurred. So this one is well documented compared to the Rhine Valley epidemic. 20,000 people lived in Paris and in the Aquitaine region of France at the time, and half of them died from ergot poisoning. I saw other estimates, though, that it expanded even higher to around 40,000 people.
So outside of Paris and the Aquitaine region?
Yeah, I think probably it expanded outside of that and it reached 40,000 people. So that is a lot of people to die from a little contaminated rye.
Yes. And people don't know this is what is killing them, you know? So they're continuing to eat it because it's
which is cheap. So crazy because it's literally black.
Yeah, I guess you're right. Why? Yeah.
It literally looks like black, moldy, bad stuff. But I guess, people are starving. So they're like, I'm risking it.
Yeah. Risk it for the biscuit.
Yeah. Or the rye bread. 17th century French historian Francois Edis de Mézeray chronicled a plague that swept through southern France at this time. So I think he is referring to the epidemic. The afflicted thronged to the churches and invoked the saints. The cries of those in pain and the shedding of burned up limbs alike excited pity. The stench of rotten flesh was unbearable.
Wow. This is not a good time.
Not good.
Yeah.
No. Between the 14th and 16th centuries, outbreaks were exploding throughout Europe, especially in the poorer populations, and may have connections to a few strange historical events.
Tell me.
1. Dancing plagues.
Ooh, okay.
So during this time, there were outbreaks of uncontrollable dancing that appeared throughout Germany, Italy, and Flanders that affected entire populations.
They were just dancing.
It's like, couple more than a couple years ago when flash mobs were really
yes.
big.
Yes.
This is what I picture. It's like
Yeah.
all of a sudden all these people are dancing.
Yeah.
Yeah. So sometimes called St. Vitus dance or St. John's dance and Tarantantism, some historians suggest these episodes could have been caused by ergot-induced convulsions and hallucinations.
So they weren't dancing, they were having convulsions.
I was like,
just a little bit.
Why did we call it dancing then?
Yeah, probably not the best name for it.
This is controversial though, because it occurred in communities where rye was not eaten. And was eaten. There were some communities that were eating rye and some that were not, and both experienced dancing plagues.
But we do know that it's present on more than just rye. It just grows easiest on rye because of the cycle.
Right, and I don't know if there's other cereal grains that were affected in other areas that could have been the cause, but I still think if you got people convulsing, you would know the difference between that and dancing.
I don't know.
I guess
if you're all having hallucinations.
Yeah, I mean, if it's more like an LSD outbreak,
yeah, exactly.
So it's not killing you, but it's giving you major high, then I could definitely see the dancing plagues become a thing. The other historical event that ergot is often attached to is the witchcraft panics.
I do feel like people want any reason to explain the witchcraft
their actions.
Trials. Yes.
That they were just shitty people.
Yes.
Yeah.
Killing women.
Yeah. Okay. So there are some theories that have proposed ergot as a contributing factor in the Salem witch trials and the witch trials in Norway in the 17th century, which was also a very, very, very bad. Like, compared to Salem, I believe it was more people died.
Oh boy.
Symptoms such as hallucinations, paranoia, and convulsions resembled accusations of witchcraft.
Resembled.
Yeah. Okay. So
I guess if you thought the witch cast a curse on you.
Yeah.
Yeah. Would you be a witch?
Yeah.
Hands down.
Yeah, so I guess if somebody is experiencing hallucinations and this is my problem though with this is because somebody is experiencing hallucinations, paranoia, and convulsions and says, that lady, she's a witch.
She cursed me.
And then everybody else who is not suffering from hallucinations and paranoia are like, you're right.
Yes, I get it. Yeah.
Like, come on.
Yeah.
All of those people that were doing the actual trials weren't poor people. They weren't eating rye. I mean, they could have been, I guess. But, they were brought in from other areas to sit on the trials. And, they were listening to teenage girls tell stories about what the witch made them do.
Teenage girls. I mean, probably not the most reliable thing of all time.
Yeah, bored teenage girls in the 1600s.
Yes.
They got nothing else to do.
Nada.
Of course, they're going to be starting rumors.
Yeah.
I was 16 once.
You were starting rumors.
No, I was a pretty chill kid. Rumors were a very big thing.
Yeah.
And, when you're bored enough, you make up whatever you want. You don't like that lady down the street. She looked at you weird. You make up a rumor. Boom. Witch trial. She hung.
Or burned.
Or burned at the stake.
Yeah.
Whichever. So I think even if ergot played a factor of people experiencing symptoms and then them trying to explain those symptoms through, instead of divine punishment, witchcraft.
Yeah.
Even if that was the case, it does not take away the responsibility of everybody else that just accepted that as an answer.
I don't disagree.
Yeah. So I'm not sure it actually caused that. I think people were just bored and cruel and hateful.
Yes.
So that's my opinion.
Fair.
Hated women. But you know what the worst part is a lot of women hating women.
Yes. But that still happens today.
Oh, it does. Yeah. It's like we got to build each other up, stop tearing each other down.
You're on a pedestal.
Yeah. Well, don't get me. Yeah, I'm on a witch's broom over here.
That was awful. That was bad. Keep going.
So, besides those horrific events, in 1582, a guy named Adam Lancier writes the first reference of using ergot to aid in acceleration parturition or the initiation of abortion by midwives in Europe.
Yeah.
Yeah, so I thought it was funny, though, because this guy writes about it, but midwives had been using it
for a long time.
Yeah. But this is the first written record. It was just common practice.
Mm-hmm.
But this was really, really risky because the dosage of active ingredients in sclerotia is hard to control. Small doses of generally 3 grains could produce strong contractions during pregnant women's labor. So you got to be very precise.
Which is not really a thing in the 1500s.
Rupture of the uterus was a result of hypercontraction and was a significant risk. So you get 4 grains, it'd be very bad.
And then rupture of the uterus, high mortality rate. Eek. Not a good time.
Not good.
Yeah.
1596, Wendelin Thelius associated the disease essentially with the rye grains. But then it wasn't until 1670 when French physician Tholier firmly linked ergot fungus contamination in rye to the actual disease. So it took them another almost 100 years to get there, 1670. So this marks ergot as one of the earliest recognitions of food-borne fungal poisoning.
Yes. It did take quite some time, but it's interesting because like the monks knew to stop eating rye so long ago.
Right.
And so they knew.
Yeah, I think it was more of food scarcity problem.
Yeah, I would agree.
Yeah, and they didn't have fungicides to stop it from growing on the grain, so they were just like, oh well, if you're hungry, you're gonna eat it.
And you might die.
Yep.
And that is a price I am willing to pay.
Okay, Lord Farquaad. Outbreaks started to die down as wheat replaced rye and became more widespread throughout the 1800s. So people were like, ugh, rye bread, gross.
True.
I like it.
I don't like wheat bread either, though.
Yeah, you don't like bread, period. So you're not a very good judge.
That's fair. I like some breads.
Yeah, in small doses.
Banana bread.
Yeah, not the same, but it's all good. In the late 16th century and early 17th century, there were observations of the link between ergot-contaminated rye and disease, but it was not until the 19th century that mycologist Louis-René Tolleson revealed the correlation between infected rye and ergotism. So it's so interesting because they're like, yeah, we know, but then we still haven't figured it out.
Yeah.
And maybe it wasn't a priority once wheat came on.
Probably not.
But this eventually led to efforts to reduce ergot contamination in rye. Eventually, larger epidemics became rare, though multiple areas have seen outbreaks late into the 20th century.
Yeah.
Yeah. Still can happen, still around.
Yes, and especially when they still are used as meds.
The first isolation of ergotamine was possible by Stoll in 1918. This led to the starting material for multiple pharmaceuticals and illicit drugs, the most famous being LSD.
Yeah.
Which was first synthesized accidentally by Albert Hofmann in 1938. After its discovery, the drug was widely used as treatment for neurosis, sexual dysfunction, anxiety, the study of hallucinations, schizophrenia, and even interrogation techniques.
Yeah, when I read that this was initially actually used as treatment in psychosis patients, I just couldn't stop thinking, imagine being in psychosis and someone gives you LSD and you start hallucinating.
Yeah.
How awful you would feel.
Yeah.
Yeah.
But going back to our very first episode about trepanation and then about Amanda Fielding.
Yes.
And using LSD in the treatment of depression and anxiety and PTSD, there is some viability.
There is.
It's just about dosage is very important.
And in the right setting.
Yeah.
Yeah.
Absolutely. Although the understanding of ergotism and agriculture have improved, it is still present and there are still outbreaks that have occurred in Ethiopia, India, and parts of Russia. Most famously, in 1951, Pont Saint-Esprit, France. Over 250 people experienced hallucinations, psychosis, and illnesses after eating contaminated bread. Several deaths occur.
Yes.
Poisoning was attributed to ergot-contaminated flour. That was in 1951.
Yeah, not
that long ago. So, still happening.
Yeah.
If you got a dark, cold, wet place, ergot is coming for you.
Yeah, but it needs to be pollinated, I believe, when I looked it up. And so if you don't have just like I couldn't grow it in our basement because it couldn't be pollinated by anything. There are stipulations to this.
Yeah.
Okay.
But I guess if you're growing it out in the field.
Yeah. In Washington.
Yeah. Yeah.
Okay, but how does all of this actually relate to St. Patrick's Day?
That's a good question. So most of the connections between ergot outbreaks and St. Patrick's Day are relatively indirect. but we like to talk about them in connection.
Okay.
So they center around Irish agriculture, rye contamination, and periodic outbreaks. Irish history, folklore discussions resurface around St. Patrick's Day, so they are all connected.
Okay.
The discussions are happening around the same time. So here's a few examples of why that might happen. So the agriculture in Ireland was really dependent on oats, barley, and rye as staple grains. And it's cold, dark, damp, wet place. So the fungus likes cereal crops, and they thrive in that. So ergot contamination occurred in multiple Irish grain harvests throughout the years. This was a regular occurrence.
Yeah.
Really.
Sometimes they like it. Sometimes maybe good. Sometimes maybe bad.
Right. And you can imagine during festivities, you might have a special day and you would eat more of those things, and then you would have an outbreak.
And you might hallucinate or you might die.
Right. You might lose your limbs.
Yeah.
And then in the religious context, because we're talking about a saint here.
Yeah.
St. Patrick, who was around in the 5th century, is the patron and saint of Ireland. So he's celebrated on St. Patrick's Day, March 17th. Ergot poisoning was often framed in religious terms, hence the name St. Anthony's fire, which was common in continental Europe. But in Ireland, they have similar religious interpretations of unexplained illnesses, and saints were believed to heal mysterious afflictions. Thus, multiple saints, including St. Patrick, were often evoked for protection. So, if you were suffering from ergot,
I imagine you'd call it probably
any saint.
Yeah.
People in Ireland were probably declaring protection from St. Patrick and asking for that during this time. So that's where it kind of connects. There's no direct event that connects St. Patrick's Day to ergotism, but
I really thought it was going to be something about the beer and how much people drink around St. Patty's Day.
Yeah, so you're having celebrations, you're eating bread.
I would survive because I'm not eating bread.
You're drinking rye whiskey.
Yeah.
You have not good ergot outbreaks everywhere. Maybe some dancing.
Maybe some dancing, maybe some convulsions.
Pick your poison.
I think if people were hallucinating and saw other people having convulsions, they would probably think they were dancing.
Yeah, that's maybe true. Yeah,
that's where I think that came from.
Yeah, this could definitely be some type of horror movie.
Yes, absolutely. It could.
The whole town is being poisoned.
Yes.
And dancing everywhere. It's freaky.
Yeah.
Yeah, but it's actually just convulsion and death.
All right. Shall we jump into medicine today?
Yes, let's do it.
Okay. We have some pharmacology to go over.
Oh boy.
I know, but it's interesting pharmacology and stuff that medical people should touch up on every once in a while. So just bear with me. It's going to be interesting. Okay. So let's talk about receptors first. We need to understand these so that we can understand how ergot affects them. So receptors are tiny molecular switches on cells, and they respond to chemical messengers called neurotransmitters. Ergot is fascinating because it can act on some of the most important receptors at the same time. That also makes it very, very dangerous.
Yeah.
So it can act on serotonin, the adrenergic system, or norepinephrine and dopamine all at the same time. Let's remember that serotonin modulates neural activity, mood, sleep, digestion, and appetite. It's also involved in cardiovascular function, bowel motility, and psychiatric processes. So,
isn't it so interesting that one thing can be like bowel motility and your brain?
Well, you've heard of new studies coming out that they think that there's like tens of thousands more serotonin receptors in your gut now than they do in your brain. And that's the whole correlation between gut health and depression, anxiety, and like other psychiatric diagnoses.
I believe it.
I fully believe it.
Yeah.
Yeah. Then the adrenergic system, which uses the neurotransmitter norepinephrine. This regulates stress responses, alertness, blood pressure, and heart rate. There's alpha and beta adrenergic. So alpha 1 causes vasoconstriction, so what we were talking about earlier, that tightening or clamping down of the blood vessels. Alpha 2 provides negative feedback to alpha 1, inhibiting further release of norepinephrine. That's going to be very, very important when we talk about ergot later. Then there is beta 1, which increases heart rate and contractility, and beta 2, which causes smooth muscle relaxation in your airways. And the way we were always taught to remember that in school for beta 1 and beta 2 is beta 1, you have one heart, so it has effects on the heart, and beta 2, you have two lungs, so it has effects on airway muscles.
I love all the things you come up with to memorize.
You have to. There's so much information.
Yeah.
Yeah. Then there's dopamine. So this mediates brain functions related to reward, motivation, motor control, and cognitive function. And it's crucial for voluntary movement, learning, and reinforcement. And we actually see effects on this in Parkinson's. Then a quick definition: the way things act on receptors can either be defined as agonist, antagonist, or a partial agonist or antagonist. So agonist activates the receptor to produce an action. Antagonist binds to a receptor to prevent the activation or block the action of agonist. So just block them from being able to attach on. And then there's partial, which means it only partially activates it or partially blocks it. So how does this relate to ergot, and why did we just have a pharmacology lesson? Specifically, when we're talking about ergot pharmacology, we're talking about ergot alkaloids. That's the most important piece here. They are structurally similar between the three most important, well, I should say very important, neurotransmitters: noradrenaline, dopamine, and serotonin. Many of these ergot alkaloids likely interact with receptors for all three of these neurotransmitters, either as an agonist, antagonist, or dual role as a partial agonist and antagonist. So as you can imagine, this becomes very hard to control. Yeah, very, very quickly. Sounds really cool. Sounds like what a dream drug. We can work on serotonin, dopamine, like all of these things at once. But this can cause a lot of undesired adverse reactions. And that also means it affects the brain, blood vessels, and hormones all at once. Goody. Not something that you really want to do. Yeah. So ergot's specific effect on these receptors. At serotonin receptors, it acts as a partial agonist, so activating it. And this causes vasoconstriction, particularly in cranial vessels. But then we've also talked about how it causes uterine contractions. It's historically been used for migraines because there is a thought process that during migraines, blood vessels of the brain can enlarge and dilate during this. And that's what causes some of the migraine pain. And so if we cause vasoconstriction of this, we could get rid of the migraine.
That's why you drink caffeine.
Yes. But as you can imagine, if there's too much vasoconstriction,
not good.
Yeah, it's essentially a stroke.
Yeah.
So these dangerous vasospasms, because of too much stimulation, causes ischemia of the brain tissue and also the gangrene of the limbs that we were talking about earlier. The activity at the serotonin receptor also explains hallucinations, altered perception, and psychosis. So that's what we were talking about earlier, how LSD was derived from ergochemistry. So as we were trying to figure out how medieval poisoning worked with this fungal chemistry, we also helped discover how psychedelic drugs worked at the same time.
Yep.
By accident.
Right.
Yes. And then kind of talked about already, but uterine smooth muscle contraction. This is via that serotonin receptor activity and the direct smooth muscle stimulation. And this contracts the uterus and reduces postpartum hemorrhage. Nowadays, we use oxytocin for this. That's what most people are much more used to hearing. Then noradrenaline, it acts as a partial agonist at the alpha-1 receptors. So this causes vasoconstriction, increased blood pressure, and reduced blood flow to skin and extremities. It also interacts with alpha-2 receptors. So let's remember that these alpha-2 receptors typically act as feedback brakes on the alpha-1 receptors and norepinephrine release. But because these ergoalkaloids can act as partial agonists or antagonists at these receptors, they disrupt the normal feedback regulation and allow for continuous vasoconstriction. Once again, bad news. Bad. So as you can imagine, like, why is this so painful and why did it get coined St. Anthony's fire? Essentially, they just have extreme cutting off of blood flow. And then on dopamine, it acts as an agonist. So it stimulates those receptors. And primarily it affects the pituitary gland, which this is so nerdy of me, I think is the most interesting gland in the whole body. It does so many things.
Favorite gland.
Yes, does so many things. Dopamine at baseline inhibits prolactin release. So further stimulation further inhibits prolactin release. And this suppresses prolactin and treats prolactin secreting tumors, which we're going to talk about later on. So because ergot alkaloids act on multiple neurotransmitters at once, and we can't really control this as it's happening, we call it a dirty drug. That does not...
Dirty.
I know. Yes. In medicine, we call it a dirty drug. This doesn't necessarily always mean it's a bad drug. It just means that it hits many targets at once instead of one specific receptor. As we said earlier, it can affect the brain, blood vessels, and hormones all at the same time, which makes it super medically powerful, but very difficult to control.
Yeah, I don't know how you would control that. I mean, really, really small micro dosing.
But it's still having those other effects.
Yeah.
So there's a lot of, I'll go ahead and talk about it. There's a lot of contraindications to this medication in the sense of if somebody already has any sort of vascular disease, you're not allowed to give them this med because it would heighten the vascular disease. If somebody already has high blood pressure, you can't give them this medication. It can't be used within like 24 hours of the triptan family of medications. Very defined contraindications, which makes it hard to use because sometimes you don't always have time to think about all of those, and or your patient doesn't know their past medical history, what medications they're on, things like that, which happens all the time. So modern uses today. We use it in migraines, so 2 different things. We use ergotamine with caffeine or dihydroergotamine. It is thought to believe that there is that arteriolar vasodilation and inflammation of the trigeminal nerve in migraines. So because this can act on the serotonin, dopamine, and the alpha adrenoreceptors, this can cause vasoconstriction and relief of those migraines. Unfortunately, it can also cause nausea and vomiting, cramps, insomnia, and transient lower limb muscle pain because of the vasoconstriction.
Yeah, I don't know.
I don't know about the trade-off.
Yeah, give me the migraine.
Probably, honestly.
I mean, migraine could make you nauseous and vomit anyway. Like, why do I need something else to make me do that?
Yes.
Plus the insomnia, I can't even fall asleep.
Yeah.
Because sometimes the best thing to do with migraine is fall asleep.
Take me a nappy. That's what I do. So ergotamine can be used as a preventative and acute treatment, whereas the dihydroergotamine can only be used in acute treatment. And then I was kind of just saying earlier, this cannot be taken within 24 hours of a triptan. And oftentimes triptans are first-line migraine medications for people with frequent migraines. And so most of the time, if somebody's coming into the emergency room with a migraine, they've taken that triptan, they've taken their Tylenol, their ibuprofen, all of the things. And so we're not really using this for migraines that much.
Yeah.
Yeah. I had a professor in PA school that taught I don't remember what this specifically it must have been like a neurology pharmacology lecture. And he loved talking about ergot and all of its uses. And I remember as I was learning it being like, wow, I've never heard of this medication ever before in my life. And I looked it up and read that it's essentially never used anymore. And I was so confused why we were focusing on it so much.
Why we're talking about this.
But he was just an old school guy, and he liked it.
I guess.
Yeah. I don't think I would ever prescribe one of these. Then it's also used in postpartum hemorrhage. The name of this medication is ergotamine. So there's 4 main causes of postpartum hemorrhage, and it's your 4 T's. And this is something you should essentially always know unless you work in very specific medical fields. So trauma, such as lacerations or rupture, tissue, such as retained placenta, thrombin, such as a coagulation disorder, and then tone. So uterine atony, which means there is no uterine tone. And this is the cause 70 to 80% of the time. That uterine atony is what we're specifically targeting when we're treating postpartum hemorrhage most of the time. And so ergotamine can be used to cause the muscle of the uterus to contract, and this can cause hemostasis, so regulation back. Oxytocin is first line due to its rapid onset and safety profile. As we've talked about, the ergot alkaloids have a huge side effect profile. But interestingly enough, ergotamine is slightly more effective. But just because of that side effect profile, we can't use it first line.
I don't want any side effects.
No.
With my drugs, please.
I mean, that's never going to happen.
Right. But I want minimal.
Yeah, these kind of side effects.
Minimal side effects, and I don't want to be having hallucinations.
Yeah. Also, it cannot be used if a woman has high blood pressure, preeclampsia, or any sort of cardiovascular disease. So once again, the more we're excluding populations, the more risky it is to give when patients come in and we don't know their full past medical history and all of the things.
Literally, better safe than sorry.
Yes, literally. Then neurological, ergot-derived dopamine and agonists such as bromocriptamine and cabergoline, also might be pronouncing that wrong, but that's okay because I don't work in neuro, are used to treat Parkinson's. So these directly stimulate the postsynaptic dopamine receptors in the brain. These are often added to levodopa, which is a huge Parkinson's drug, to help manage the symptoms. They're not used as monotherapy. And then we're jumping back into the pituitary gland. And I think people are going to realize why I like it so much. Okay, listen up. So bromocriptine can also be used for disorders related to the pituitary gland. So hyperprolactinemia is present in disorders such as galactorrhea, prolactin-dependent mammary carcinoma, amenorrhea, acromegaly, and anovulation. And let's break those down a little bit.
Yeah, I don't know what any of those things are, so you're going to have to tell me.
Galactorrhea is abnormal production of breast milk, not related to breastfeeding.
Just like random?
Just like random.
That's a nightmare.
It's a nightmare. And it can also happen in males. Yes.
Well, I mean, like, it doesn't discriminate.
It doesn't discriminate.
It
No.
said anybody and everybody.
Yeah. Basically, one day people just start producing breast milk. Not in large quantities, not enough to pump. Okay?
That is the worst part, though, is that it just seeps through your shirt.
Yes.
Without you noticing, and then you just look like you got little wet spots.
Yeah.
Embarrassing. That is brutal.
Amenorrhea is the absence of menstruation. So primary is the failure to start periods by 15 years old. Secondary is the cessation of periods for more than 3 months if your previous periods were irregular, or more than 6 months if they were previously irregular. I want you to take a guess, though, what the number one cause of secondary amenorrhea is.
I don't know.
Pregnancy. Yes.
Yeah.
That's a big board question. They're like, what should you order first? And it's like a pregnancy
test. Yeah.
Yeah.
Okay.
Makes sense.
But like when you say it like that, I'm like, what could it be? You know, like, oh my gosh, racking my brain for all these weird things. And you're like, oh, pregnancy. It's like, duh.
Yes. Yes. Acromegaly is the excessive release of growth hormone, so it causes overgrowth of bone and soft tissues, and it's most noticeable on the hands, feet, and face. So if you've ever heard of a story of somebody who was 30 years old and all of a sudden started outgrowing their shoes, they likely have acromegaly.
Oh, man.
And this gets to be severe. It's not something you can just never treat.
Oh, that would be awful too. Like I've been in the same shoe size for
since middle school?
Yeah, pretty much. And I've been rocking it.
Maybe 5th grade for you. If you didn't know, Brittany has tiny feet. We are the exact same height. And I wear 2.5 sizes larger than you. 7.5 to 10.
I can wear 7.
Yeah. Tiny feet.
Yeah. I like it. It gives me more options.
Does it?
Yeah. I can still technically wear a boy's 5 if I wanted to, because that's the equivalent to like a women's 6.5.
That's not really what I would share with the world, but I'm glad you're willing to.
I mean, just...
And imagine one day we could wear the same shoes if you just got some acromegaly.
No, that would be awful. I don't want bigger feet. I like having little feet.
Little baby feet.
Yeah.
And then anovulation, so failure of ovaries to release a mature egg during a menstrual cycle. It's a major cause of infertility, present in about 30% of cases. So this is all related to the pituitary gland, and it's not everything. But this gland is just this tiny little thing, and it does so much.
Interesting. Evolutionarily wise, we're like, let's put our eggs in this gland basket.
Yeah.
Over here.
Yeah.
Where is it?
In the brain, I'm pretty sure.
Oh, okay.
Yeah, pretty sure it's in the brain. But it's all about releasing hormone levels. Obviously, it has effects through the whole body because of that.
Right.
Yeah. So with things like this, we want to reduce the high prolactin levels and shrink the associated pituitary tumors, which are called prolactinomas, by inhibiting hormone secretion. Symptoms such as that galactorrhea, amenorrhea are alleviated. Sometimes people do have to go in and have these tumors removed, though. Bromocriptine, which is one of the first-line treatments for this, is an ergot alkaloid.
Wow.
Yeah, so still used there.
That's crazy.
I know.
So there's not a lot of side effects with that one? Or you're just like willing?
I don't know the side effect profile off the top of my head, but assuming that we use it in Parkinson's disease and that we also use it for all of these pituitary disorders, it must have a relatively safe side effect profile.
Just that.
I don't know if that alkaloid is. Yeah, I don't know.
Interesting.
Great question. So we've talked about it a lot. Drugs. LSD was derived from this. Ergot contains lysergic acid, which is the chemical precursor used to synthesize LSD. And like we said, we're going to do a whole episode on LSD because there's just too much to unpack.
Got to.
And then let's talk about overdose and toxicity. So we've kind of talked about this a lot in terms of side effects.
Yeah.
But what does this actually look like? So there is the gangrenous or vascular ergotism, which is the severe vasoconstriction causing ischemia and then causing gangrene, so the death of that tissue.
Yeah, so that's the burning.
That's the St. Anthony's fire.
Sensation. Kind of like when your arm falls asleep because you're sleeping on it.
Yeah. I imagine it's much more painful than that.
100%. But I'm trying to think of something that's like, think about that times 1,000.
Yeah.
And then it's like so tingly that it has a burning sensation. That's how bad it is.
Yeah.
Ugh.
Yeah. bad times. And then there's the convulsive or neurotoxic ergotism, which causes those convulsions, hallucinations, delirium, severe headaches, and tremors.
That's the one I'm choosing.
That's the one I'm choosing for sure.
When I get to choose which ergotism that I get.
So you might ask, like, if we know that this has to be so highly controlled and all of these side effects, how can this still happen? And for all of my friends that have studied medicine, I'm going to bring back some demons, okay? CYP 450 interactions. Let's talk about it very quickly, very briefly, but important things to know for drug interactions. So ergot alkaloids are metabolized by the CYP 450 liver enzyme. So think of the liver as a drug filtering factory. And the CYP 450 system is the machinery that breaks down drugs so that they don't accumulate. Some medications can block that enzyme so they can't clear the ergot effectively. Common offenders are clarithromycin, erythromycin, ketoconazole, and an HIV medication, ritonavir. So relatively common drugs. When this happens, the ergot isn't metabolized, and this causes the ergot blood levels to skyrocket, which causes the vasoconstriction and the accidental overdosing on ergot, even if you took a normal dose.
That's a mind fuck.
I know. I had a patient within the last couple of weeks that was on every medication it felt like known to mankind, and I needed to put her on an oral systemic antifungal medication. She had already failed topical treatment, and ketoconazole is the best oral systemic antifungal medication. And unfortunately, she was on another medication that is also processed by the CYP liver enzyme, and I could not figure out what to put her on. And so I went up to pharmacy, who unfortunately then a code blue came in and then a trauma came in right after. So they're in the room on those so that we can immediately give medications without orders. And the patient did indeed eloped, not against medical advice because we never got to have the conversation.
Yeah.
Eloped while waiting. And the nurse had tried to ask her to stay, had told her we're trying to talk to pharmacology, but this interaction, the CYP 450 liver enzyme, I am unwilling to take the chance for a week for a patient to be on medications because drugs can build up so quickly. So let's end on a quick little clinical pearl. Ergot toxicity still happens today because of the reason we just talked about. Obviously not nearly as likely as it used to be, but still can happen. So there can be a migraine or ergotamine overdose, drug interactions, or even herbal supplements where people don't realize what they're taking. Classic symptoms of this: severe limb pain, cold extremities, and absent pulses. And when I was summarizing this all up, I thought, how is this different from compartment syndrome? And if you don't know about compartment syndrome, it's your 6 Ps. Maybe that's also bringing a double back from PA school or from med school, whatever you're in. But very important things to know. So the key difference is it's a vasospasm versus increased compartment pressure in compartment syndrome. So in ergot, it's often bilateral or symmetric. There is minimal swelling. Versus in compartment syndrome, it's after fractures or crush injuries and is usually localized to one compartment. And the classic finding of compartment syndrome is there's pain with passive stretch of that muscle. So if a limb is cold with absent pulses but not tense, think vascular causes like ergotism or arterial occlusion. If the limb is rock hard, swollen, and hurts with passive stretch, think compartment syndrome.
Compartment syndrome is
terrifying.
Ugh.
We have an old friend that had compartment syndrome 2 different times, bilateral calves, with no inciting injury.
And then you could see it on the outside.
Yes. Well, because she had to go in for a fasciotomy.
Yeah.
Yes. But her cases were super interesting because was not
sports are very
not there what caused hers.
Yeah.
Sports are not high risk for this.
I know. I had when I was playing softball in junior college, I had one of my coaches had it in her ankle, like right between her shin bone and her ankle, and you could see it.
Yeah.
Like it's still there.
Yeah. It's wild.
It's super painful.
So treatment, stop the ergot, obviously. You may need to put the patient on vasodilators, prostaglandins, nitroprusside, and even sometimes surgical intervention for these patients. And that's it. That's our medical side. I think it's super interesting for someone who had never looked into this drug before because it's not widely used. I thought this was a super interesting thing to look up.
Yeah, it's also interesting that they did use it for so many things. Specifically, we find a lot of it attached to pregnancy can be extremely a tough subject.
Yeah.
Because you're talking about something that could help but also could hurt, but also could be used in a way to help people by removing tissue, and things like that. And so it's just very complicated. But then at the same time, you have people that are like divine intervention.
Always.
Yeah. And I think that's when we talk about the ethics autopsy, as we jump into it, that's my big thing that I took away from this is the religion in the disease's explanation. And this doesn't just happen with ergot. It's happened many.
And continues to.
Yeah. It's not new. I think I'm disappointed in the Middle Ages a little bit, which
100 years from now, someone's going to be disappointed in us, okay?
I'm disappointed in us right now, but I'm disappointed in the Middle Ages because looking back into history and like I said, the ancient civilizations and Romans and how advanced everything was and their views on medicine and how close they were getting to some real medical discoveries through their explanations were a little off, but you could see the evidence-based practice and they're like recording everything. And then you get to the Middle Ages and they're just like, throw that shit away. I'm talking about divine punishment, demonic influence, witchcraft, all of the above. And it's like, damn it. No.
We were doing good.
Yeah, we were on the right track. And then you got people just going crazy because I don't know, maybe it's just the lack of being able to read, but I don't think that's it because even today we have...
Well, I think it just goes to show how quickly and easily society can be influenced.
Oh, yeah. Influencers were a thing back in the medieval times.
Influencers have always been a thing.
Right. So it's just...
And they're still getting me today. Come on.
Yeah. Sometimes they still get me too.
Yeah.
But yeah, it's just disappointing, that we could let that happen. And instead of just being like, oh, it's the black things on our grain, maybe we should think about not having
black shit
in the grain, and maybe that will make us feel better. Like the fact that it took so long, I think probably is just because people were like, it's God. What?
Yeah.
Come on.
I agree. I think for me, I was thinking about drug discoveries, and sometimes they are from poison. So we see that ergot has many uses, but started out as a poison. Go back to botulism and how we use that for Botox now. And then digitalis, which is a heart failure medication, and that actually is poison derived as well. I shouldn't say poison derived, and it's just interesting because how we get to all of this is through lots of really shitty things, but then we're like, a use for this. We're going to continue to use it. It's like, well, is that safe to use?
Yeah.
I don't know.
Yeah, I don't know. It's interesting though. We got to do, us as humans. We're like, let's try it again.
Always.
I wasn't so sure that first time.
Yeah. Or I know a few people died, maybe like 20,000 in 1 year.
But maybe if we just specified doses, it won't be so bad. It's like we don't want to give something up. It's like, man, just let it go.
But then I go back to my talk that a lot of people ask in Western medicine why we don't use more natural supplements.
And why don't you use rotten looking fungus?
But the answer is that we do, but then it has to be very strictly regulated. And then people forget that this was initially a natural use of something, and now we use it as a defined medication.
Yeah. Yeah. So would you keep the ergot or cut the ergot?
I think I'd cut it.
I don't think it's necessary.
Not anymore, for sure.
Yeah, sure.
Do I think it probably saved a lot of women in the 15, 16, 1700s with postpartum hemorrhage? Sure.
Yeah,
Did it
but
maybe kill?
Yeah.
A lot?
Only if you knew exactly, like the midwife knew exactly what they were doing. And it's still extremely risky. I mean, last ditch effort.
Sure.
Like we said, anybody's willing to do anything to save their life. But at the same time, does that compare to the tens of thousands?
But I don't know. What about my pituitary gland?
What about my gland?
Because bromocriptine is still used first line.
Yeah.
Oof. That's a little rough.
That's
my favorite gland. Come on.
I can't be giving it up like that. Yeah.
Yeah.
So I don't know. That one could go either way. It's a gray one for sure.
Yeah.
Yeah.
And we'll end on some listener questions. We got 2 again this week.
Yeah. So do you think ergot poisoning could actually explain historical events like the dancing plagues and the witch trials. Be honest.
Okay, I do think it can explain at least the dancing plagues. You're telling me LSD is derived from this and you don't think people were dancing in the streets?
Yeah, I could see the dancing plagues, but also at the same time I'm like, bro, convulsing doesn't look like dancing.
When they are hallucinating, yes.
It was just a new type of dance.
Yes, breakdancing.
Just laying on the ground convulsing. That was the birth of breakdancing. I don't know if you know that.
We have no idea.
That's my swag.
We're going to have to start using it. Okay. And then, should medicine continue studying powerful natural toxins like ergot if they can also cause mass poisoning? And that comes back to like botulism and using it for Botox.
Yeah.
It's a good question.
Yeah, it's a good one.
I think you have to.
Yeah.
I think all things can be overused and cause toxicity.
Sure.
All things. I mean, Tylenol, for God's sake. It's a great medication.
Yeah.
You know, but if you overdo it, if you overdose.
Yeah. You can overdose on anything pretty much. So
exactly.
Anything
can become
quote unquote
poisonous. Yeah.
Yeah. So I don't know if you guys have seen, we have a tree with a link.
A tree with a link.
Also known as a link tree.
Yes.
With multiple links. And you can find everything in one place. So go ahead and check out our show notes or any of our bios on social media. Click on that little link tree and it'll take you to everything that we've ever linked.
Yes. Things we're going to be working on here soon is an Amazon storefront. So let us know specifically if there's something you want to see. If you want to see how I survived PA school. If you want to see things I take in my work bag every day now.
Yeah, your work bag is pretty cool.
I do like my work bag.
Yeah.
And I do like the things that I keep in it. I use them pretty often.
Yeah. Yeah.
Yeah.
That would be a good one.
Yeah. That's what I meant by it. I didn't mean
just the bag itself. That's what I was thinking about.
All right. You can listen anywhere you get your podcast. We do ask that you help support us by leaving a review, a comment, and sharing our podcast with people that would be interested. Helping us drive our engagement on social media is huge. So a quick like, a quick comment, things like that actually do go a really long way. And currently that's our most organic way of
getting new listeners. Yeah, and like you guys have been doing, but keep doing it. If you have an idea for an episode or a case, please send it our way. We're building a massive episode list so that we can keep doing this forever.
Yes. We have a long list right now.
We have a long list, so we're not going anywhere.
Anytime
Don't you
soon.
fret. DM us on social media with that idea, or if you have a story that you would like us to share on the podcast, you're willing to share, go ahead and DM us that as well, and hopefully we can put together a little episode about all your stories.
Yes. Sneak peek of next episode. I know we cheated you a little bit, but you're jumping back into leprosy next week and the Leper King. So you'll be back on track.
That's a good one.
That's a good one. I enjoyed that.
Yeah.
Yeah.
So I think that's it. Have a good rest of your week and just think about ergot poisoning.
Yes. And if you're a bread lover, you probably would have died.
Yeah.
I would have survived.
You would have. I would have died.
You would have died, yeah.
Carbs are life.
I like carbs, just not bread.
That's the silliest thing I've ever heard.
All right, friends. Class is dismissed.
Stay safe.
Stay curious.
And don't try this at home.
Unless you own a bone saw.
Yeah, don't be trying some ergot at home.
Try to grow it and see what happens.
Just...
You think there's people that try to grow ergot to make LSD at home? 100%.
100%.
Yeah, 100% there is.
Yeah, don't even... Why'd you even ask that question?
Yeah. But you could try it at home too.
Yeah, okay. Don't do that. Bye.
This podcast is for educational and entertainment purposes only. We discuss the history of medicine, not your personal medical situation. Nothing you hear on this show should ever be taken as medical advice, diagnosis, or treatment. Some of the information discussed may be incorrect or become outdated over time. We do our best to stay current with medical knowledge, but medicine changes quickly. Additionally, because we do not work in every specific field we discuss, there may be times when we misspeak or misinterpret information. We're all human and we're doing our best for the podcast. Every medical case is unique, and your health decisions should always be made in consultation with your own qualified healthcare professional. If you have any questions or concerns about your health, please reach out to a licensed provider who can give you guidance based on your individual needs.